Good evening, Dr. Barry Kritz, Houston's dancing psychiatrist, and I am in Cologne, which I learned today is the fourth largest city in Germany after uh, Berlin, Munich, Hamburg. Actually, Berlin, Hamburg, Munich, and Cologne is the fourth largest city in Germany. Learned that today while in Cologne. Wanted to talk with y'all today while I sit on the port of Cologne, talk with you all about adult ADHD. So frequently, people get told that you're an adult, you were a successful professional, you got through college, you can't have ADHD. This can also manifest into later adulthood or even young geriatric age, where people are having cognitive difficulties, where indeed undiagnosed ADD can still become apparent. So ADD and ADHD, in contrast to what we were taught as when I was in school and what a lot of people still believe, including some of my fellow physicians, you generally do not grow out of ADD. What you do grow out of frequently is the hyperactive component of ADD, the problems with sitting still, squirmy, squiggly, wiggly. But the part that you generally don't grow out of is the cognitive component of it. That's the problems with paying attention, concentrating, staying on task, staying focused, being easily distractible. Now, you might have been able to get through college, you might have been able to get through medical school, you might have been able to get through professional school, you might have been able to perform at one job with untreated ADD, but now your job changes. Now you have kids, now you have a spouse. Now your job changes where you have to do a lot more work that's dull, mundane, and rote rather than novel and interesting. And ADD people struggle with information or tasks that are boring, mundane, and rote. But a lot of what we have to do in life is boring, mundane, and rote. So that could manifest with ADD. Also, changes in your hormonal status as an older adult could also bring about changes in your cognition, which can exacerbate those pre-existing ADD symptoms. So what I'm asking clinicians out there is to be open to the fact that even though the ADD was not diagnosed in childhood, look for symptoms that were suggestive of that in childhood. Also look, do they have any children who have ADD? Because ADD is one of the most hereditable conditions we know. If your child has it, one of the parents usually has it. It's her Give you an example of that. It has a hereditability factor of 0.75. Height has a hereditability factor of 0.9. That shows you how hereditable ADD is. So once again, ADD can manifest, can be diagnosed in adults, even adults who are not diagnosed as kids, even adults who did make it through college and seem to do okay in a previous profession. So don't rule out ADD in adults. Be open to the concept of ADD in adults. Also remember the rule of comorbidity with ADD. Just because patients have ADD doesn't mean they also can't have depression, anxiety. Sometimes successfully treating the anxiety and depression seems to make those ADD symptoms go away. Often it doesn't. I'm over my 3 minutes that I try to keep these at. So that's what I'm going to say. Remember ADD. Ask your clinician about ADD. And this is Dr. Barry G from Cologne, Germany, and wishing y'all an amazing, amazing rest of your day.